Hey Live Active community, it's Dr. Ahmed here. Welcome to video number 2 of this 7 series. These are the 7 ways to improve health outcomes. In video number 1, we talked about access. Please check out that video if you haven't already. Please like this video if you like topics like this and conversations like this. We want to keep the conversation going. Please write comments and subscribe to our channel. When we talk about cost, it's very dear to me because the reason why I do what I do now is because one of the patients that I've met on the floor simply had a massive stroke because she could not afford a medication that cost 1 cent a pill. And it was completely preventable. When somebody has high blood pressure, taking 1 cent a pill, that cost can save catastrophic injury like a massive head bleed. And so she changed my life, she changed my whole career. And so it's a very important topic. To me, cost and access are bigger issues in healthcare than coverage. So I'm going to talk about 2 points today when I talk about cost. Number 1, I'm going to talk about delay in care because of this rising cost issue and the fear of cost. And number 2 is the system flat out denies care, which increases the cost to access services. So number 1 is that a lot of our loved ones, we see it every day, right? I mean, people with that chest pain, abdominal pain, wound, oh, give it another day, it's going to get better. But then because we fear going to the ER, the time it takes, we don't know how much it's going to cost us. We have no clue. Even with insurance, right? We have a plastic card, but we still fear. We're like, I don't know what that bill's going to be. I mean, it's the only service that we accept and pay for, allow that business model to happen unlike anything else. I mean, if it's, if we order food, we go for an oil change, we go get gas in our car, we want to know the price, we want it to be transparent, we even shop around to find the best gas prices. But yet with our health, we accept this model where it's a mystery, it's not transparent, it's not clear cut. It's fascinating. So we've seen that, delays in care because of this fear of cost leads to multi-organ problems, complex problems. And that's why accessibility in relationships and all that matters, and that's so important. Now cost, if we eliminate that barrier, imagine where the cost for a person to come into the office or access their physician, text, email, phone, video is free of charge. There's no cost to it. They come into the office, there's no copay, there's no per visit fee. And whatever we do in the office, if it's wound care, EKG, breathing treatment, skin tag removal, whatever, there's no extra cost to that. Imagine that. I mean, that would be so much easier. People would be proactive rather than reactive when it comes to their health care. So delay in care because of the fear of cost is a big problem. We just don't address it head on and talk about it. Instead, the rhetoric and the conversation is all around coverage. Well, let's talk about that. If you have insurance coverage, you have a plastic card in your pocket, well, as a physician, and many of my physician colleagues, and maybe you yourself have experience in this, doesn't mean insurance does not mean you're going to get health care, right? There's networks, there's prior authorizations, there's flat out denials. That increases your out-of-pocket pay, or it can also mean that you don't get the latest and greatest treatment, which your cardiologist, your physicians say, hey, this is the medication you need to take. But if there's a denial or prior authorization that delays it, ultimately denying it, then you are getting a treatment that isn't the best, that isn't recommended. Other stories of insurance companies denying inpatient rehab from a hospitalization after a stroke. A rehab doctor, everybody says, hey, this is a good rehab candidate, and the facility, the rehab facility will even say, hey, this is a good patient for us. We accept them, bring them over, we have a bed, but the insurance company can still deny it. So that's how crazy it is. And so we appeal, we do peer-to-peer, we argue, leads to physician burnout because it's so frustrating. And the patient doesn't get to rehab because we lose most of the time. And so they end up going to a nursing home, or they have to go home with home health, or subsequently the patient has a fall, they have some other complication, right? And it's because we know this patient needs inpatient rehab. So in all these scenarios, this is how cost starts to rise, and we really have to eliminate this barrier in order to improve health outcomes in our community. So we just touched the surface on this. This is why I believe that if we have to eliminate the fear of cost and eliminate those costs when we're treating patients, especially in the primary care setting. Make the accessibility free, use all the tools that we talked about in video 1. Number 2, when they come into the office, make everything that we can do in the office free of charge. And so there's no nickel and diming experience, so we have to get away from that. So please like our channel, subscribe to it, comment. This is a huge conversation. We're going to move on to video number 3 in the 7 series in 7 ways to improve health outcomes. So get out there, live active, take an active role in life, in your finances, in your health, in your mental health, and God bless.